Hello and welcome guys to the another episode of my discussion series. Today I am going to have conversation with one of my dear friend Anne, and she is going to share her experience about her study in pharmacy, and also she is going to share her experience about working as a pharmacist after getting Bachelor of Pharmacy degree from Australia. So let's welcome Anne and let's learn from her experience. So Anne, welcome to my video. I'd like to thank you a lot for agreeing to be a part of my video. It really means a lot to my channel and also to my viewers. So before moving into the topic about pharmacy, would you like to introduce yourself to our viewers?
Thank you, Vishu. Yeah, thanks for giving me the opportunity to, be here and share my experience about the pharmacy journey.
Yeah.
So my name's Anne and I'm the registered pharmacist working in Sydney. I graduated from University of Sydney in 2011. Yeah, it's been a long time ago. Yeah, have to rethink twice. Yes. So I did my internship in 2011, become a registered pharmacist 2012. Then I've been working as a pharmacist manager since 2015 up until now.
So it has been almost 6 years you are working as a full-time pharmacist.
That's right, yes.
So, and that's great. I want to ask you a little bit about your university degree. So, can you a little bit elaborate about how long was the course and how did you get admitted into Bachelor of Pharmacy, because you originally are from Vietnam, right? So
that's right.
So you were here as an international student. So can you share about how was the journey of you as a student in Bachelor of Pharmacy?
Yes, for sure. So I came here as an overseas student from Vietnam.
Yeah.
When I came here, I already finished year 12 in Vietnam, but I need to redo my year 12.
Yeah.
And I did take a HSC course. So back then, I think we used to call it UAI.
Yeah.
Not ATA like nowadays. So I used my mark. To get into the Bachelor of Pharmacy course and in University of Sydney.
Yeah.
Besides the GPA mark in general, I also needed an English requirement as well, I believe. Yes, and there's one little exam called SAT exam. So it tested you like a bit about the English and the IQ level as well. So that's another requirement. So I'll just give you a bit of introduction about the Bachelor of Pharmacy and Master of Pharmacy. So in Australia, you actually work as a registered pharmacist, and you can either graduate from Bachelor of Pharmacy or Master of Pharmacy. Bachelor of Pharmacy is for, the high school student who could get into straight away from year 12. And that course will take 4 years. Master of Pharmacy take only 2 years.
2 years.
However, you needed, either a Bachelor of like medical science, a Bachelor of Health. Then you use that as a prerequisite to get into Master of Pharmacy. When I did my Bachelor of Pharmacy, it took 4 years, and then I become a pharmacy graduate. Then I have to apply for a placement so that I can do my 2,000-hour internship year. During that year, we have to work full-time, finish 2,000 hours of practice. We also had to go through 2 exams with Pharmacy Board of Australia. So we had to pass the written exam and an oral exam at the end to become a registered pharmacist to legally practice in Australia. That's about the course. In terms of the application, I was lucky in my circumstance that the course that I did was year 12, and that course was also a foundation course of University of Sydney. So they liaise and prepare all my paperwork. Yes, but I believe the requirement was you need to satisfy the ATA mark or a GPA mark. You also need an English requirement of, I think that time we use IELTS. So IELTS 7 points or more. So in terms of application, we need academic transcript, we need English requirement certificate, we need the SATs exam requirement.
And also, do you guys need like letter of motivation or recommendation letter?
Fortunately, at that time, no, I did not need that because, you know, the course that I did was directly liaised with the University of Sydney.
Yeah.
But I guess if you applied from overseas, then
you need those things. Like, why do you want to study that?
That's right.
Also, like letter of recommendation from your supervisors or professors or something like that.
That's right. Because in Master of Pharmacy in UTS, I believe you need to also sit an interview as well.
Yeah. So, can you also share a little bit about what is the difference between being a student here at Australian University and also being a student in your country like Vietnam or some other Asian countries?
Yes, sure. So I did not have a chance to go through university course in Vietnam. However, when I redid my Year 12 here, the way of teaching and education was very different. So in Vietnam, it was a lot about memory, theoretical stuff, even math, science. They test you a lot on the memories. Sometimes, you know, it can be very theoretical and you did not understand the concept. However, here, the maths, I remember in Year 12, the maths teacher was very inspiring because she was, she only taught us about the basic concept and how to use the understanding and apply it into practice. You know, so in the exam, I was actually more chilled because I didn't have to memorize a lot of things, formula, you know, you only need to understand it and you're able to perform in the exam. Also, the exam question can be very broad, so you know it's not easily just you can find it in a textbook. So
I also realized that while I was studying in Canada, it was not about exam only. Right? There were a lot of assignments you had to do. There were a lot of practical things you had to do, and exam was more relaxing than back home. Exactly right. So I think here it's more practical and back home it's more kind of theoretical.
Theoretical, right? Yes, that's correct. And in the hindsight, I think they teach you a lot about different skills as well. You know, the assignment, it teaches you about teamwork. Teamwork skill, problem solving skill, time management skills. So basically here they prepare you for the job market. That's right. That's exactly right. And you don't have to memorize everything, you know, about pharmacological, but it's more about how to do your own research and how to use your proper research to gain your knowledge. And So, and one thing I wanted to ask was, so while you were studying Bachelor of Pharmacy, what are the courses you had to take? Can you a little bit elaborate about that? Yes, of course. So you meant the course during the uni or the course that what I didn't have to be before? Or during the uni? Yeah, sure. So I remember, it was a long time ago to be honest, but I remember the brief structure. So Year 1 and Year 2, we study a lot about basic and more like a preparation step, for example, about ethics. Ethic is really important. We also study about, you know, the first year, I think a bit more about biology, anatomy, chemistry. Also pharmacokinetics, you know, for people who like to progress their career in pharmaceutical company, pharmacovigilance. In third year, then we started going a bit more about like pharmacology. So that was a lot of applied knowledge in community pharmacy. And fourth year, it's about health promotion program. So and also, can you a little bit share about to study Bachelor of Pharmacy or Pharmacy degree here in Australia? What would be the tuition fee? So in 2000, I started in 2000 and 2007 and finished 2011. So luckily for me, the fee wasn't that high. So it started from 25,000 and it slowly went up to about 30,000 per year. Per year, as an overseas student, but I believe now it could be a lot higher, like up to about $40,000 a year. So if you are international student, it would range somewhere between 35 to 40,000. That's right. But if you are a domestic student,
then it would be way less, right?
That's correct. Yeah. I
And also,
believe then you can do the different pathway like HEX.
Yeah. So what is X?
Oh, HEX is, I believe it's for Australian citizens. So you're able to put it on the loan and then you paid it off slowly later on.
Oh, yeah.
So that's called HEX. But with the permanent resident, I believe you can pay a lot cheaper. So it's only cost around 12,000 a year, I believe. Yeah.
So you need to really get prepared financially if you want to pursue this degree.
Oh yes.
Yeah. And what do you think about? Can you work as an international student?
Oh yes, of course, and that was really important as well. So, as a pharmacy student, you know, I strongly advise the student to look for a part-time pharmacy assistant job for themselves. And as a pharmacy student, I believe you can get the reward rate, which is a higher rate compared to a normal qualified pharmacy assistant level as well. So the pay will go up from year 1 up to year 4. So it was really good in that regards, and it gave you a lot of insight about how the pharmacy world run in practice. And, you know, you can apply all the knowledge that you learn in uni to be able to assist your clients, your patients at work.
And I think that also exposes you to Australian working environment.
Oh, yes,
which
definitely.
is really important if you want to work here in Australia after getting degree.
Yes, definitely, yes. Because here, to be able to find a job, I think the employer emphasize a lot on the work experience and what skills you have achieved in the past. So it's a lot about communication skills, problem solving skill, people management skills, things like that. So a lot of people think, you know, pharmacists, we have to be good at chemistry and, you know, biology and...
Actually, you need to be good at communication.
That's correct.
I think communication is not only for... Communication skill is not only for pharmacy. So that is one of the most important skill, whether you are in the field of pharmacy or any other field, right?
That's correct, yes. Because, I mean, you have the knowledge, you know, you're a good clinical pharmacist, but how to relay to your patients, how to... I mean, explain and again the personal relationship. It's all based on the communication skill.
So, and I want to talk a little bit about the job prospect after getting pharmacy degree. So you graduated in 2011, right?
2011, yes.
So can you share to our viewers how difficult was it for you to get a job as a pharmacist? What was the process like? Can you share a little bit about that?
Oh yes, definitely. So when you graduated from the Bachelor of Pharmacy, then that you need to apply yourself, you know, for an internship year into a community pharmacy, or you can also apply that into the hospital if you want to become a hospital pharmacist. So that's only 2 options that you can go for your internship year. So the process, you know, you have to obviously provide the academic transcript and prepare your own resume, prepare your own CV. And most important thing is you have whatever experience you have in pharmacy and in the pharmacy practice world, and you have to list it all, even your work placement that you did during uni, you know, volunteer work, work placement, study placement, you know, any sort of applied experience you have, make sure you list it on your CV. Yes, and to get into hospital pharmacy, it's a little bit more competitive. So to go for the interview, you have to prepare a lot of clinical questions. So
basically, you put your CV, resume, cover letter, and then you just apply through websites like Seek or...
That's correct.
So basically it's mainly Seek, right? Is there any other pathway to get a job?
So mainly on the website, also hospital farm, the internship position is also advertised on website as well.
So you can look at individual website,
Yes, that's right. Like Indeed, Seek.com. What else I can think of? You just walk in a community pharmacy, like if you feel like that, the pharmacy that will have your very good, what do you call, like learning environment, then you can just walk in like, can I speak to a pharmacist manager?
And then
you just present yourself. And I think that's really important because the impression that you create is very important. One thing I like to add is if you like to progress your career into a TGA, that's Therapeutic Good Administration of Australia. So that's the government body, governs all about the medications and regulations. Then you have to go through an agency. And if you like to be a bit of different career pathway by working for TGA or pharmaceutical company, in pharmacovigilance, things like that, then most of the people will have to go through an agency.
So in Australia, here in Australia, what do you think? What would be average wage or salary structure look like for a average pharmacist?
Yes. So a non-experienced pharmacist, as in like newly registered pharmacist,
graduates,
they can get it started from about full-time, about 80,000 package a year. And then, with your experience and if you progress into a pharmacist manager, then it can go up to 110, 120,000. And yes, and if you decide to go into pharmacovigilance or director of pharmacy in hospital, then it can go up to 150 to 200,000 package.
So you are saying it's a really rewarding career, right?
Oh yes, that's right. So fortunately, the in community, the pharmacy graduate can easily find a job with a fairly good starting point compared to other professions.
So what about nowadays? Is it more competitive than 10 years ago, or what do you think?
Yeah, so the industry get a bit tricky for community pharmacists, I have to say, because there's a lot of discount chemist chain, like, Chemist Warehouse. So they very price focused, and it's very clearly distinguished from a health focused pharmacy, like the pharmacy that I've been, working at for the last 10 years. So with the price focused pharmacy, it's more about like the food chain, so it's more about like a production line. You only get the basic reward rate. However, if you work for an independent health focused pharmacy, you can get above the reward rate, and also it brings you a lot of self satisfaction. Rewarding, when you're able to gain the customer relationship and have time to use your knowledge.
So, and what do you think, because you have already worked as a pharmacist for more than 5-6 years, right? So what do you think about this career path? How it feels like to work as a pharmacist?
I love to be a community pharmacist. The reason being because I love talking to patients. It's not only about like medication, counsel them how to use the medication correctly, but you also gain a very personal relationship with the customers, and you one of the most accessible healthcare professionals. For a doctor's office, you have to book their appointment, whereas for pharmacists, you can just walk into a pharmacy and approach them. And being a most accessible healthcare professional, you're able to have a conversation with them. You get to know them. You gain their trust. You don't only help them with in terms of medication-wise in general, but just in even like health, general health advice or general social problems, difficulties they have. And you can also refer that patient to your A-Light Health. So I refer a lot of patients to either a physiotherapist or optometrist or a GP next door, even, like a aged care facility, rehab facility.
It's really good. We have a pharmacist like you whom patient can approach like really quickly, right? With the doctor, you need to take appointment, so it might take few days or few weeks or few
that's
months
right, and it's
right?
quite time constrained. But with us, we're able to have a bit of time just to have a conversation with them. So our customers really love it. And it's really sweet. Like sometimes they just walk in to say hi, share a bit our personal life, and they make us some goodies, bring us chocolate. So a lot of self-rewarding in that regards.
So I think I didn't cover that question. So after getting a pharmacy degree, what are the career paths you can choose apart from community pharmacist or a hospital pharmacist?
Okay, so you can, it actually can be very broad actually. So you can become, do more further research and become a lecturer at uni. Teaching pharmacy. You can become a consultant pharmacist, and some people can be a medical representative for a pharmaceutical company.
So basically, apart from directly working as a pharmacist, you can choose research career or teaching career, or work for a pharmaceutical company like Pfizer, Moderna, or some other companies, right?
That's right. That's correct.
So, and because obviously this is a highly rewarding career, right? And there might be some people who want to switch their career, let's say working as an accountant for 5 years, and they want to be pharmacist after that. So what do you think? Can they do that?
Yes, of course, I believe. So, say if you study a non-health, bachelor, then I believe you can do a few prerequisite courses to be admitted into Bachelor or Master of Pharmacy. So I believe you can do a few courses like pharmacology, biology for about a year or two, and then you can,
So that's great. So we are slowly coming towards the end of today's video. We don't have obviously all the time, and you are also busy. Before wrapping up, you want to give some suggestions to international students who wants to come to Australia to get a pharmacy degree, or you also have some suggestions to domestic students who want to get pharmacy course here in Australia. So do you want to add something?
Yeah, sure. So I mean, the most important thing I found was that I was able to work as a pharmacy assistant in the pharmacy throughout my Bachelor of Pharmacy, and that 4 year of work experience, has helped me a lot in able to find a position for my internship. And it allows you to utilize all your, study knowledge at school and apply that into the community pharmacy practice. So I strongly advise, an overseas student to have a part-time job in the pharmacy sector.
So thanks a lot, Anne, for being a part of my video.
Thank you.
I really appreciate it. And guys, I hope you liked today's content, and if you like my video content, please do not forget to leave your comments down below in the comment section, and also please do not forget to like our video, and also please do not forget to subscribe to our channel. And also I wanna add that Anne is planning to open her YouTube channel about pharmacy. So Anne, you wanna a little bit elaborate about that?
Oh yes, so it's still in the planning process though. It's still very in the beginning.
That would be good,
I just get inspiration from Vishu,
Thanks, thank you.
But I just want to utilize all my pharmacy knowledge and how to use, use the scientifically evident research to be able to give advice on over the counter, so non-prescription required medications, vitamins, and as well as medication using in general. So that would be exciting. So
that would be good. I'm looking forward to the opening of your channel. Good luck to that.
Thank you.
So guys, we came to the end of today's video. I hope you liked it. I'll see you again in the next video. Until then, bye. Thank you, Anne.
Thank you. Thanks very much, Vishu.